Hey there. If you're in the early stages of pregnancy, then this one is definitely for you. We're going to break down a really critical topic and give you a super clear, evidence-based plan to navigate this time safely and with total confidence.
All right, let's kick things off with a pretty important number. About 1 in every 100 pregnancies is an ectopic pregnancy. Now, that just means it has implanted outside the main part of the uterus. And knowing this isn't about scaring you, not at all. It's about being prepared.
You know, back in the day, this condition was pretty much always a surgical emergency. But the goal of modern medicine, it's to completely flip that script. The entire approach now is about finding it early, which can transform a life-threatening situation into something manageable, often treated with just a simple injection. So, why the ticking clock? Well, because this isn't just about some routine checkup. It's about understanding a hidden risk that has a very real and very short deadline. Timing is literally everything. Okay, so what is an ectopic pregnancy, really? To put it simply, it's when a fertilized egg decides to set up camp somewhere it's not supposed to. Most of the time, that's in one of the fallopian tubes. And believe me, its location is what makes it so critical. To really get a handle on why this is so dangerous, let's use a simple analogy. It'll make everything click, I promise. So, think about your pregnancy's journey like a car trying to get home. Now, in a normal pregnancy, the car, that's the fertilized egg, it just cruises smoothly down the highway, which is the fallopian tube, and parks safely right inside the house, the uterus. Easy peasy. But with an ectopic pregnancy, that car gets stuck in a massive traffic jam on the highway. It never makes it home. And right here, this is exactly why that traffic jam is such a huge deal. The uterus, your home, is this strong, muscular house. It's built to stretch and grow. But the fallopian tube, that's more like a thin highway flyover. It has zero give. It was never designed to stretch. So as the pregnancy grows, it puts this incredible pressure on a structure that it just can't handle it. So you see where this is going, right? The whole goal, the entire point of early pregnancy care, is to spot that car stuck on the flyover before it causes a total collapse. Catching it early prevents a rupture, which can cause massive internal bleeding and turns into a real medical emergency fast. So how do we do that? How do we spot it? The good news is this isn't about guesswork at all. There is a super clear evidence-based plan that takes all the ifs and buts right out of the equation and just puts your safety front and center. All right, let's jump into the action plan. It's a really simple 3-step protocol. We're going to use objective, real data that you and your doctor can follow to make sure you're safe. Okay, these are the 3 pillars of early detection. First up, the 6 to 7 week scan. We'll get more into that in a sec, but it's the only way to see that everything's in a safe spot. Second, we've got the 48-hour HCG test. What's that? It's basically 2 blood tests, 48 hours apart, to make sure your pregnancy hormones are rising like they should. That helps rule out a bunch of issues. And finally, the pain journal. Sounds simple, but it's a super important tool for you to just track the location and intensity of any pain you might feel. You put these 3 together and you go from just hoping you're safe to knowing you are. So step 1, and honestly, this is the most important one, schedule an ultrasound. It needs to be between 6 and 7 weeks from the first day of your last period. Look, a home urine test is great. It tells you, hey, you're pregnant. But only a scan can tell you where that pregnancy is. It's the only way to know for sure that it's landed in a safe location. You know, when it comes to pregnancy, there is so much advice out there. And unfortunately, a lot of it is well-meaning, but actually pretty dangerous. So let's just cut through the noise and separate those cultural myths from the medical facts that will actually keep you safe. And wow, this slide just lays it all out, doesn't it? The difference between myth and reality. First off, no food you eat can cause an ectopic pregnancy. It's a biology thing, plain and simple. Second, that advice to wait to see a doctor, that's incredibly dangerous. You miss that critical window for non-surgical treatment. And finally, and this is a big one, no, a doctor can't just move the pregnancy. It's a biological impossibility. At that point, your life has to be the #1 priority. Okay, so we have our proactive plan, but beyond that, it is absolutely critical that you know the warning signs, the stop everything and get to a hospital now signs. So, you've got a positive pregnancy test. What are the symptoms that mean you need to go to the emergency room right now? I don't care if it's 3 in the morning, do not wait. Okay, really pay attention to this list. We're talking severe one-sided pain, dizziness or feeling like you might faint, or a dark, watery spotting that people often say looks like prune juice. All of these are serious, but there is one sign on this list that is the most specific, the most crucial one of them all. Seriously, if you only remember one thing from this entire explainer, please let it be this. A weird, sharp pain right where your shoulder meets your arm, that is a classic sign of internal bleeding that's irritating your diaphragm. This is a true code red, a real emergency. Do not brush it off. I know. Hearing all of this can sound pretty scary. But listen, the point of this isn't to create fear. It is the exact opposite. It's all about empowering you. Because by understanding these steps, by knowing the signs, and by having a clear plan in your back pocket, you're taking active control of your health. You are moving from a place of what if to a place of I know what to do. You're ensuring the safest possible outcome for yourself. Just by being here and listening, you are doing everything right.